to be guided by, okay, we have Hema Amma, who is going to introduce this wonderful human, purpose-driven superhuman, before we give mic to Dr. Arun Sharma. So, Hema Amma, please do the needful.
Namaste Guruji, Namaste everyone, and happy morning to everyone. Today's morning is for me a dream come true, and I'll tell you why. First of all, thank you so much, Guruji, for accepting our invitation to share your wisdom with us. And I feel deeply humbled and privileged to be able to talk about you, Guruji, because I have been like the Ekalavya and you like Dronacharya for me. And this goes back to the COVID times. And one good thing that COVID did was bring a lot of knowledge into our homes through the webinars and workshops. And I've attended a lot of your workshops starting then and the webinars, and I've tried my best to absorb every bit of wisdom from whatever you have shared. And a lot of people who listen to me when I take sessions or talk about it would recollect how I keep quoting and crediting Dr. Arun Sharma for a lot of the wisdom that I have received about the natural way of living. Every little bit that I have learned has a lot to do with what I've learned from this grandsire. And you guys recollect a lot of favorite quotes. I mean, if you have to know about Dr. Arun Sharma, there are decades of work behind his life. There's a huge lineage behind him supporting everything that he's doing about yoga, about Ayurveda, about natural hygiene. I'm not going to talk about that. I'm going to talk about 2 or 3 things that I've held on to like dear life from the time I've heard them from Dr. Arun Sharma. One of my favorite quotes is, don't check your body, check your habits. And I've passed it on to almost everybody I come across and say, this is what you need to do to find out what exactly is wrong with you. Another thing is eat only when your hunger is mature. I'd heard that for the very first time from Dr. Arun Sharma. There's so many such things. 2 more things I'll share because then I will be hijacking the session if I'm going to talk. So I'm going to hand you over. And my request to all of you is to hang on to every word that he says because there is wisdom in every word. 2 more things I'm going to share. Another thing that I remember him telling was fulfillment completes life. And the lack of fulfillment will invite disease. And one of the things that went to my vision board was about studying and reading the scriptures. Guruji had said, have faith in scriptures. And he had also mentioned about the Aditya Hridayam. And thanks to him, I learned it so that I said, okay, I'll make it part of my daily practice. And before I finish and hand over to Guruji, I would love to thank Ankita and Mandana ji for being the means to connect with Dr. Arun Sharma out of the blue. And this is, for me, dream come true. Over to you, Guruji, and all of you. Stay charged, stay focused, don't miss anything. Welcome, Guruji.
Dr. Arun Sharma ji, please unmute kar dijiye. Press the unmute button in the call. Yes.
Can you hear me now?
Yes, perfect, sir. Perfect.
Hey. Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vasishyate. Om Shanti Shanti Shanti. That is complete. And this is also complete. From that complete, when we take out something complete, that remains complete, and this will also remain complete. What is complete? Self-help. Everything is within you. You don't have to search outside for cure. That's what it means. We have introduced several practices here, meditation, breathing, and all that. These are all little things, little movements, but the main goal is to realize that you are capable of not only healing yourself, and you are able to heal others just by simply wanting to heal. That's all. What is healing? There's nothing like disease. This disease, that disease, the world is bewildered with names of disease, so many different names of diseases, and that scares people to any length of time. For each disease, there is a ton of quotes coming that this disease is that's explaining so many things about each disease. That is like explaining different devils. Langda Bhoot, you must have seen in some of the movies. "ये Langda Bhoot aa raha hai," or that explaining all that. You're wasting your time, wasting your energy. There is only one thing, that is health. Health and more health. That's all. Remove all the complications. Make life simple. Simplicity is the essence of universality. It's applicable to one and all. So when we try to talk about nature cure or natural health science, we have to focus on making it simple. Let people talk about complicated diseases, this symptom, that symptom, this part of the body is affected. There are so many parts of the body. If you keep naming different parts of the body and try to deal with that particular part of the body with certain herbs or certain medicines, you are wasting your time. When you make it simple, you are able to deal with all the problems. Your doctorate you've already done. The meditation system that each person introduces to you is okay. It's nothing wrong. But each person has to evolve himself to meditate on his own. Focus on the light within you, not a light outside, not a spot outside. There are so many different ways of asking people to meditate. This is that names of so many kinds of symptoms and treatments. This is that yoga, that is this yoga. All kinds of names are there. Respect them all. But make it simple, your own. You are the best doctor. You are your best doctor. Nobody else. Healing comes from within you. It does not come from outside. That person can heal me. This person can heal me. Don't complicate your life. Just focus on yourself. Make life simple. There are only 5 guidelines: ample exercise, adequate rest, positive food, positive thinking, and an occupation that combines your skill and passion to help others, to help others, to help others. If it doesn't help others, there's no use of your occupation. Your goal of life depends on helping others. If you focus on that, any occupation that will help. How can my painting help others? You draw sketches and show it to others. And that if that sketch brings some happiness to others just by looking at the sketch, then you have got your goal. Breathing. How can breathing be my occupation? Pranayama. Running makes your breathing better. Inspire others to run and improve their breathing. Once they improve their breathing, their overall personality will improve. When overall personality improves, they will be able to find out what is their passion and stick to that passion. Sticking to your passion, improving your skills in that particular area will improve your overall personality. You don't have to look for a cure of a disease. No matter how sick a patient is, call his attention to improve his passion. Oh, he's so sick, we cannot talk about that. There is no such thing. Nobody is sick. He's feeling sick. Bring him out. Talk to him nicely, jokes and acting, singing. So many different areas are there where people are actually very, very good, but they have put that their skills and passion aside. पीछे धकेल दिया, उसको निकाल के बाहर आइए. Bring that out and that person's personality will come out. And how did this cure happen without my dealing with spinal bath or sun bath? No therapist, but you've already started healing that person. Then other applications can come. Your first and foremost thing is to understand the personality of a person. He's a person. Every person has got a personality. ये अच्छा बोलते हैं, ये अच्छा गाते हैं, ये अच्छा नाचते हैं, ये अच्छा ड्रॉ करते हैं. वो सब में जो स्किल है वो छुपा दिया गया है, उसको पीछे हटा दिया. एक गांव वाला जो लैंग्वेज कुछ नहीं जानता, वो भी बहुत अच्छा बोल सकता है. ये जरूरी नहीं है. It's not necessary to have a high flown language skill. Think about it deeply. You don't need a high flown language to express yourself. And if you encourage each of your patients, each of your persons with whom you deal and study their personality, you got it. You got it. That is nature cure. How does nature cure every disease? It is not something like sunbath or pranayama that cures. Your approach to the patient, the way you deal with every person has the secret. आज जो मैंने कहा इसके बारे में सोचिए and deal with different persons and ask their interests. Then you have already reached half of the treatment. Healing का half पार कर दिया. उसके बाद आप सन बात दो या ना दो, स्पाइनल बात कराओ कि नहीं कराओ, कोई बात नहीं. Then he will accept anything that you give for diet. He will accept anything that you ask him to do for exercise. Once you understand his passion and encourage it, then he is your best friend. You are his best friend. फिर सुनते हैं आपकी बात. ये सब ट्रीटमेंट को एक साइड रखो. Person to person, you make friends of that patient. दिल पिघल जाएगा उसका भी, आपका भी. अरे इतना अच्छा आदमी है. रोने लग जाते हैं. ये आप जैसे किसी ने मुझे समझा नहीं. जिसने अपने आप को भी देखा नहीं है, उसको देखने के लिए हेल्प करेंगे. You will help him to see himself better. That's all I have to say for today. You can ask any questions about hydrotherapy, chromotherapy, all kinds of things. Everything dissolves into this first and foremost thing. Make a friend of your patient. Encourage his talent. Encourage his spirits. That's all I have to say.
Wow. That's all you have to say, and that's all we all have to listen. We had to listen. In such a short span, you have said the core of everything required for anybody to become happy, healthy. And I was getting, Guruji, this the feeling which we call in our community gulu gulu. Gulu gulu is a feeling which you, sometimes the words cannot define, but the waves and the energy passing from the head till the toes is like gulu 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 gulu. I was getting the gulu gulu uh, because first of all, because you were speaking the truth from the bottom of your heart and soul, and that always gives gulu gulu. Secondly, it is so much aligned with what we have been building for last 2.5 years in Ubuntuverse. Exactly the same skill, passion combined to the compassion. When skill, passion combined to compassion, you become your own healer. You become a purpose-driven superhuman. And coming from you as a person who has worked with thousands of people, seen the life, and have done the research of all the kind, it just strengthens our core, our approach, and the way we are building community. I right now I don't have any question. If I get any question, I'll ask. But I invite anybody in this chat. If you have any question, keep one question at one person, and because I want to cover more people, and if there's more time, then you can ask second question. So you have to raise your
If
hand.
people don't ask questions, I will start the question.
Yes.
Let people answer.
Thank you. But we have Venkatesh who wants to ask you a question. Venkatesh, do give a short introduction where you're from and your name, and then ask a question.
Hi, can you hear me?
Yes.
Yes.
Hi, I'm Venkatesh. I'm calling
Show me
in
your
from.
face. Open your
Uh,
camera and show me your face.
okay, for that you will need to give me a minute. I'll tell you the reason later, but let me just give you the question. Um,
Okay.
So I'm calling in from Bombay. My and very happy to attend. Thank you for all the things you said. So if I can, my question would be drilling down what you just said of focusing on yourself first, be the best person you can be, and then you can approach things in the most constructive, efficient manner of anything you want to do. Um, I think it's very good to hear that, and I would politely and humbly say it's not the first time I've heard this. But how do you enable this approach when you are not used to this approach? Like, how do you show self-compassion? Can you please say a few things that would that would help us look within us, be the best friend that we are looking for within ourselves? Thank you.
Forget yourself that you are a doctor. Forget that you are going to help a person get rid of his disease. And start with the idea that you are going to learn from the patient. You are going to learn from the patient how to deal with him. How do we do that? By asking questions. आप कहाँ से हैं, क्या क्या करते हैं, what do you do, what's your interest in life? Forget all about your disease or symptoms, and whatever treatment you have done so far, put them all aside. Now let us talk to each other. Tell me what is the interest in your life. If you start that way, then he will open up. The first and foremost thing is to open up the patient to make his friendship. And then he will tell you a lot of things, and you can tell him all about what you are interested in doing, and all that will begin later.
Guruji, 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 just maybe there is one clarity which maybe we miss giving. So all of these people are not doctors. There is no doctor in the whole call today. They all are individuals and they want to become their own doctor. So Venkatesh's question was, ki, how can I become my own doctor and become my best friend? So I think you were giving answer rightly, but there was an angle that we are treating somebody else.
Yeah, we have to first and foremost think about ourselves. What is the passion in my life? If you search about your passion, then you will pursue your passion. You will pursue your passion and your personality will come out. Disease will vanish. Whatever problem you had in your body and your mind and the spirit, they will all vanish. The ones at once, immediately when you realize who you are, what is the interest in your life. If you do that, that's enough. अपने जिंदगी में every person has got a passion. I want to be a best actor. I want to be the best singer. I want to be best artist. कुछ भी नहीं है, खेल रहे हैं वो, कबड्डी खेलने में अच्छा लगता है, ठीक है, doesn't matter. Whatever you want to do, कपड़े पहनने में भी किसी का बहुत अच्छा इंटरेस्ट है, कलर बदल बदल के डालते हैं और अच्छी तरह से पहन के निकलते हैं, तो वो सब पर्सनालिटी डेवलपमेंट के लिए है. मुस्कुरा लीजिए, एक बार अच्छी तरह मुस्कुराइए. That is the beginning. Once you are able to smile properly, you have made your personality. Look at everybody else as your best friend. यहाँ से शुरू होता है. Whoever is worst enemy to you, how can you make that person your best friend? यहाँ से शुरू होता है आपका प्रयाण. Your travel starts from there. And you will see wonderful things happening to you in your life. एक हफ्ते में आपका खुद का पर्सनालिटी बदल जाएगा और you are getting successful in whatever you are trying.
Thank you. Thank you, Guruji.
Have I answered your question?
Yeah, thank you very much.
Welcome.
I'm calling in from Bombay. Bombay is quite warm. It's winter, but it's still warm. So I had to go and wear a shirt. I'm sorry. That's why I didn't
That's
want
okay.
to right away. Anyway,
जहाँ
but
मैं हूँ वहाँ तो snowfall हो रहा है यहाँ.
अच्छा, ठीक है.
Today it's now my evening time.
Okay, all right. But I'll take two things from what you said. That is, learn to smile properly, and how can I make the other person your best friend. So I'll take these 2 points from what you said, and I will think about it. Thank you very much.
Show me your smile before you go.
Bye.
Okay.
Thank you, Venkatesh. Thank you. Next is Sudha Kumar. Sudha Kumar, please introduce in short and ask a question.
Namaste, Guruji.
Namaste.
Namaste, ji. Namaste, ji. I'm so happy. I'm from Chennai. Basically, I'm from Chennai, but I'm traveling. I'm in Calcutta now. My passion is to travel.
Okay.
Yeah, Guruji, I have this. I just wanted to know. My diabetes is quite under control, but the foot part of it's always numb, especially the toes are numb. The left foot is numb. Now, how do I make it normal? Thank you, Guruji.
First of all, you have to think that it is normal.
Okay.
You have to make it better.
Okay.
ये नम करके आप सोचना नहीं. This foot is going to perform better.
Okay.
With that positive thought, you start putting
Okay.
that in cold water, hot water, alternately, and use that foot more often. And stand on one leg on that affected foot, and then stand on both. Do some spot running, and You do the pranayama, breathe out and hold the breath. All these practices will eventually make that part go away. All the symptoms have gone. After 1 week, call us and let us know that you have really improved. Okay.
Thank you, Sudhaji. Thank you. All the best. And your foot is normal.
Yeah.
It's normal. It just it is requiring for a little attention. Hence, is doing some drama. It wants more love from you. Just give.
Okay. Okay. Thank you so much, Abhinav. Thank you. Love
Thank
you all
you.
so much. Love
Thank
you.
you.
Love
Love
you.
you so much, Sudhaji. Thank you. Well, Lalitambaji, please introduce and ask.
Shubhodaya, Dr. Arun and the team. I'm from Bangalore, Nama Bengaluru, India. Yeah, one is, as you said, the earlier question, I always keep saying smile should be our signature to start with. You smile with everyone. So that is the thing that happiness increases to you and as well others. My question is, if simplicity is something
First,
that
show
should
me
be,
your smile. No,
I'm here,
that's artificial.
I'm here.
Haha.
Yeah. So my question is, if simplicity was that to be at the core and very important, why are we complicating our lives with so much of material things? See, once to close, when we close our eyes, then we can go inside. But we open our eyes, the world is so chaotic outside, which we all know. We are running behind material things, etc. I think that is where the stress, everything starts from. So and you're also seeing with this digital world, the kids are going through, there's no games, they're always on the digital. Detoxification is required in every family where there are kids, including my house. So now what it takes as a policy for people like you and many others to join the governments and implement these as a curriculum itself, right? Like all other kind of physical education is there, but yoga is not really the thing mandatory in many schools, right? It has become optional kind of thing. So how can we get it as a policy itself, and this yoga pranayam and the simplicity, everything as one of the parts, so that in that last next 10 years from grade 1 to whatever they learn, they inculcate and then it becomes easier, is what I was thinking. If that eases the stress on ourselves and the world, is there something as a policy we can do?
First
Thank
and foremost, remove your disturbance from the head. From your head, remove the disturbance. Purnamada Purnamidam Purnat Purnamudachyate. Start with the sloka. Purnasya Purnamadaya Purnameva Vasishyate. With that understanding, you go. Love everybody. Keep your face, loving face all the time. Smile and accept everything as it is. जैसे चल रहा है वैसे मान लीजिए. If you want to correct others, correct yourself. जितना आप अपने आप को अच्छा करेंगे, आपकी बात सुनेंगे लोग. When you want
you
to
very
start a movement against another big movement, you have to start within yourself and gather more and more people in your side. And voice has got to be powerful. Your voice can be more powerful if you believe in whatever you say. Practice first and before you preach. अपने आदतों को और अच्छा बनाइए और अपना पर्सनालिटी को बढ़ाइए. हमेशा अपने बालों को ठीक से रखिए, सीधा पोस्चर रखिए. जो बातें करेंगे वो साफ होना चाहिए, क्लियर होना चाहिए. ये सब प्रैक्टिस करेंगे तो आपकी बात को सुनेंगे लोग.
Thank you, Guruji.
अपने आप के अंदर डाउट हो जाएगा तो आपकी बात सुनेंगे नहीं कोई.
Thank you for your kind words. I will note.
Welcome.
Thank you.
Thank you. Amazing answers are pouring from Dr. Arun Sharma. Thank you for all the questions. Next, I have Vasant. Please introduce and ask.
Namaste, Guruji. My name is
Namaste.
Vasant. I'm from Goa. My question is around fasting. I'm not good at fasting. So how do I start it? Like what is some guru mantra from you to make fasting a part of my life? That's it.
आपका नाम को अपना लीजिए वसंत सब में खुशी देखिए start fasting by missing one meal. Yeah, I'm able to do this. Next time, next week, I will miss 2 meals. That's how you start. आप कर सकते हैं. Start little by little, and when you are successful, you can tell others. If you're not successful, you can't tell others. Try little by little.
Thank you, Guruji.
Namaste.
Thank you.
Thank you. Small steps. Wow. Beautiful. Okay, next we have e-learner. Wow. E-learner, please introduce and ask.
Thank you, sir. Thank you, Abhinav. Thank you. Good morning, Guruji. And I'm very happy to join today's session. And I want to said one line also, Vasant, on questions. Like always, hunger is in our mind, not in our stomach. So it's about the fast. When we are thinking about the fast, so hunger is always there. So we can survive 4 days without food. And even I applied this spectacle on me when I was in a traveling. I don't like outsider food, so I managed myself in traveling without eating outside food, and then I realized, yeah, hunger is always there. If we are engaged in good activity, we can survive. My question to Guruji, like you about the personality, this is a very good thing, like good habit increase and personality. But nowadays as this is a part of our curriculum, CBSC, ICSC, we have so many things in our mind nowadays in the kids, like so many books, so many diaries, so many dresses, so many colors are there. Yeah, this is good. Every day have a special day, but somehow it is also not good for our climate, for pollution, as we are trying to become minimalistic. So what is your opinion about this? How we can impact the world, or even India for self it? So this is my question.
खुद ही को कर बुलंद इतना खुदा बंदे से खुद पूछे कि तेरी रजा क्या है. That is the answer. That means improve your own personality by improving your practices, and you can tell others. Your words will not have any power if you don't practice yourself. Not only in eating or
Right.
fasting, but your words, your action, your dress, your walking, your everything has got a style which can be even better than what it is now. Now, I don't want to pinpoint anything. You point yourself. How can I improve my speech? How can I improve my personality? Everything you have to work on it, and you have to meet me after 1 month. Talk on this and see which are the areas you improved and how confident you feel. हम आपको देखना चाहते हैं 1 महीने में.
Sir, I wrote some words recently on personality. I want to read it out. My own definition.
Okay.
Person, education, responsibility, and skills. Open mind, natural attitude toward the world and toward yourself. Liability for others, interest teaching you. Means teaching myself here. So just I got through this conversation. I'm thankful.
Thank you, Arti. Thank you so much. E-learner, always learning. Wow. Next is Charles. Charles, please introduce and ask a question. And if you can show yourself, better. Yes. Mute. You're mute. Unmute, please. there is some sound problem. There is some sound problem. Can you rejoin? Rejoin? Can you rejoin? Rejoin that. Rejoin. I think some audio problem. Yes. Meanwhile, I'll go to the next person. You rejoin and I'll take question after. We have Sanjana. Sanjana, please go ahead.
Yeah. Firstly, so thank you so much, Guruji, for the lovely session, really. And I just want to ask, I'm recently facing it. I don't know what is it. It's premenopause, or I don't know what exactly. But I can eat as much roti as I can. I used to have only two, but now I can have four, five, and then I stop myself. Uh, Last, I think, since two times I'm noticing this. Ke I can eat. I'm telling my daughter ke ek aur bana de, ek aur bana de, and then I stop myself. After five rotis, I'm still able to eat. So I'm really not able to understand what is going on with my body. Yeah.
इसमें समझना ये है कि हम कितना ज्यादा खा सकते हैं वो नहीं, कितना कम खा के रह सकते हैं वो देखना है. How can I survive with less and less, even less? There are more valuable things than roti. Earth element comes from roti. There are 5 more elements. पृथ्वी से क्या है, आगे क्या है, पानी. पानी को थोड़ा पीना है, ज्यादा नहीं पीना है. जो पीते हैं पानी को मुंह में रोक करके फिर निकलना है. और उसके आगे क्या है, पानी से आगे हवा.
Air fasting.
एयर फास्टिंग नहीं होता, प्राणायाम करना होता है.
Pranayam, okay.
सांस बाहर निकाल के रोकना पड़ता है. कितना देर रोक सकते हैं, उससे हेल्थ बढ़ता है ये आपको पता नहीं. यू नो, आपके पीछे लिखा हुआ क्लीन एयर. तो हवा को रोकना है बाहर निकालने के बाद. कितना देर रोक सकते हैं ये प्रैक्टिस करते करते, और आपका जो है शक्ति बढ़ता है.
And so, Guruji, जैसे
सूर्य
एकादशी में I can do fasting. I'm totally on water since yesterday, परसों रात से. तो एकादशी पे एक mindset हो जाता है कि I don't have to eat. तो I'm okay with that.
नहीं, रोज का क्या है, फास्टिंग नहीं करना है, लेकिन ज्यादा सब्जी खाना है.
Got it.
कच्चा सब्जियों का एक खुराक.
Yeah.
Only raw vegetables, that's
Yeah.
one meal.
Yeah.
Only boiled vegetables, another meal. थोड़ा सा रोटी आ सकता है, रोटी में भी कसा हुआ सब्जी मिला करके रोटी बनाना है.
Okay.
तो आपका कंजम्पशन ऑफ वेजिटेबल्स हैव इंक्रीज्ड. इसी तरह से हर चीज में और हल्का बनाते जाएंगे तो हेल्थ बहुत बढ़िया हो गया.
Sure. Thank you so much, Guruji. Thanks a
Welcome.
lot.
Thank you, Sanjana. Thank you, Guruji. Okay, Rituji, you go next and then Charles. Rituji.
Namaste, Dr. Arun. Namaste to all. My question is bit heavy. Dr. Arun, you said that there is nothing called disease, but there are, diseases, because I recently lost my husband due to meningitis. He had brain tumor and he had to undergo 3 surgeries and radiations and all, but he did take every precaution, all this fasting and maximum fruits and vegetables in his diet, but still it happened. So when you said there is nothing called disease, so this doubt came to my mind, that diseases do exist. And whatever precautions he took, whatever care he took, I don't feel anybody can take that much of it. Pranayam and every possible thing he did. And he was very positive till end, okay, some miracle will happen. But still it happened.
I'm sorry to hear that, but it still remains, truth remains always truth. उन्होंने क्या किया क्या नहीं किया, I did not monitor it. I take your word. एंड जिसको जाना होता है चले जाते हैं। कोशिश हमें यही करना है कि प्राकृतिक मार्ग से जीवन को चलाना है। एंड देयर इज लोअर लेवल ऑफ हेल्थ, हायर लेवल ऑफ हेल्थ। दैट हायर लेवल ऑफ हेल्थ को इंट्रोड्यूस करना है। डार्कनेस बोल के कोई चीज नहीं होता। देयर इज लेस लाइट और मोर लाइट। लाइट इज रियल, डार्कनेस इज अनरियल। ये सच्चाई को कोई छुपा नहीं सकता है। दिस इज द ट्रूथ एंड ऑलवेज रिमेन ट्रूथ। लाइट और आ गया तो डार्कनेस चले जाता है, हेल्थ और आ गया तो डिसीज चले जाता है। इसमें कोई दो बात नहीं है, शक है नहीं। देयर इज नो डाउट अबाउट दिस। सम पीपल मे नॉट अग्री, दैट डजंट मेक अ डिफरेंस। डार्कनेस विल ऑलवेज बी लैक ऑफ लाइट। जब लाइट लाते हैं तो डार्कनेस क्यों चले जाता है? जब हेल्थ बढ़ाते हैं तो डिसीज क्यों चले जाता है? I am sorry to hear whatever happened to you, but we need more help, more advice from known people. Support और चाहिए हमारे मूवमेंट में। ये और लोगों को बढ़ाना है जो हेल्प कर सकते हैं दूसरों को। Sorry to hear your story.
I'm sorry that I made this atmosphere a bit heavier in the morning, but
No,
just
that's
out
okay.
within.
Yeah, it was your closest partner of life.
Thank you.
Thank you, Dipti, for sharing your pain and question. And thank you, Dr. Arunji, for respecting the question, pain, and still bringing the truth in the question and the answer. Thank you, thank you. This is what this community and this growing together, that we can share our pain and we can listen and we can heal that. Thank you. Charles, would you like to ask a question?
Sir, I just want to ask, am I audible now?
Yes.
Yes.
Okay. Good morning to all of you, and Dr. Arun, thank you so much for this amazing and beautiful session. Thank you so much. And my question is a little bit different from this question. That सर मैं हमेशा ही मैं ही समझती हूँ कि मेरा ईटिंग हैबिट्स पे भी काबू है। मैं मतलब इम्प्रूव मैं इतना नहीं भागती हूँ खाने के पीछे भी, एंड मैं प्राणायाम भी करती हूँ। बट कहीं न कहीं मुझे ऐसा लगता है कि मैं जो काम को लेकर के है, जो मेरा वर्क है, एंड या फिर जो मेरी पढ़ाई है, उसको लेकर के भी मुझे ऐसा लगता है कि मैं बहुत पीछे रह गई हूँ औरों से। तो इसको आप बता सकते हैं कि हमेशा कहीं न कहीं एक फोमो रहता है मेरे अंदर कि मैं बहुत पीछे रह गई हूँ, ज़माने से, दुनिया से। तो उस चीज़ को लेकर के आप कुछ बता सकते हैं कि मैं इस अंदर की ये जो इनसिक्योरिटीज़ है, इनको कैसे कि इनको कैसे मतलब एक तरीके से जीतूँ, इस
ये
पर
तो
जीत हासिल करूँ?
बहुत आसान है। आपके इर्द गिर्द ऐसे बहुत लोग हैं जो कि आपसे कम जानते हैं।
बस स्टिल
हेल्प करिए।
मैं जी सर।
तो एक लैंप है, वो रोशनी, बाकी बहुत बड़ा ब्राइट लाइट्स होते हैं। जो जो एक छोटा सा लैंप में खूबी है, जो उसमें स्पिरिचुअलिटी है, वो बड़े लैंप में नहीं है, बड़े रोशनी में नहीं है। आप अपने अंदर का जो आत्मा है उसको देखिए। यू आर अ गुड पर्सन एंड यू आर अ वेरी गुड पर्सन एंड यू कैन हेल्प अदर्स। आप अपने आप ही बड़ा हो जाएंगे बाय हेल्पिंग अदर्स।
थैंक यू सो मच।
आप गुरु हैं, ये समझ लीजिए कि आपसे कम जानकार बहुत लोग हैं, उनको हेल्प करिए। हेल्प करते 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 आपको बार बार लोग पूछेंगे और आपके क्या बोलते हैं, जागृति हो जाएगा। यू विल बी अ डिफरेंट पर्सन ऑल टुगेदर।
ओके सर, थैंक यू सर।
अपने पहनाव, अपना हेयर डू, सब को सिंपल करिए और देखिए क्या पर्सनालिटी निकल आता है। You must meet me after 1 month and tell me how you are doing, how you have made yourself better.
Thank you, sir.
Namaste.
Thank you so much. Thank you so much, sir.
Welcome.
Thank you, Guruji. Thank you, Charles, for bringing your fear out. That is a first step to heal. You are already healing yourself. In 1 month, do let us know.
Thank you
Thank
so much, sir.
Thank you. Next is RK Anand. RK Anand का hand बहुत देर से खड़ा था. RK Anand, would you like to ask question? RK Anand?
हाँ, नमस्ते
हाँ,
नमस्ते।
बोलिए.
मुझे पूछना था, बहुत बहुत धन्यवाद आपके सेशन के लिए, काफी ज्ञान की बातें थी जो आपने
RK,
दिया
can you
है।
please ask in English? There are a lot of people here who are not
okay,
competent. Yeah.
okay. Thank you very much, Arunji, for your inspiring words and words of wisdom. I had a question. I have developed asthma over the years, dealing with stray animals. I used to come in contact with last 5-6 years now, and I did a mistake of not wearing my mask. So the dust particles from these stray animals, whether it's dogs, cats, has caused me to get asthma. And sometimes it really gets very bad attacks when I come in contact with them. Now I wear mask, of course, and I'm on the doctors, of course, are given some pumps to take when it happens. But what is a natural way to come out of heal my body completely of asthma? What do I need to do? Anyway, I do steaming and I take, the salt water, haldi water, that I do. But I needed a natural remedy which can permanently, cure my asthma.
Asthma is a blockage of air passages.
Right.
What is the blocking material? Is mucus. Mucus is a combination of acid plus salt. Yet, instead of acid, if you have alkaline food and if you do a lot of running, it's gone. It's solved. Gradually, if you are taking vegetables, you are producing mucus which is not so thick and it will not block the passages. And दौड़ लगाना छोड़िए, मत छोड़ना. आप गाना गाते हैं?
जी, गाता हूँ.
2 लाइन कोई गा के सुनाइए.
ठीक है. आप ही का अल्फाज. खुदी को कर बुलंद इतना कि हर तकदीर से पहले खुदा बंदे से पूछे, बता तेरी रजा क्या है, तेरी रजा क्या है.
बहुत बढ़िया.
धन्यवाद.
Thank you.
धन्यवाद.
Thank you, RK Anand. Thank you, Dr. Arun Sharma
मैंने
ji.
और लोगों से नहीं पूछा, आपसे पूछा है.
आपको
गाने
कैसे
के
पता
लिए.
कि मैं गायक हूँ?
बताइए. Thank you.
Dr. Arun Sharma,
धन्यवाद.
कितने स्पीकर बुलाए गए हैं? कोई वजह है? उनको स्पीकर बुलाया गया है, यही वजह है. ऊपर पढ़ ले रहे हैं सबको. स्मिता जी, प्लीज सवाल पूछिए. आपका इंट्रोडक्शन करिए शॉर्ट में और सवाल पूछिए. स्मिता. स्मिता, आप अनम्यूट करिए. हाँ, यस.
Namaste, Guruji,
नमस्ते.
and very happy morning to all. I don't have any question as such, but it was a pleasure आपको early morning सुनने के लिए. That was my pleasure. Thank you so much.
Welcome. This is my evening. अब रात हो रही है यहाँ.
Okay. For us, it's a early morning, and been listening to you, it's like a pleasure for me. Thank you, Guruji.
Welcome.
Thank you, Smita. That was so sweet. Okay, Shiraz. शिराज, आप हैं? आपका हाथ रेस था, कहाँ गए? मोना जी. मोना जी आप सवाल पूछ सकते हैं अभी अनम्यूट करके. यस.
Yes, yes. Yeah. Yes, good morning, good evening, sir. Ma'am, I'm
कैमरा
Mrs.
उल्टी तरफ हो रखा है. आपका घर दिख रहा है, आप नहीं दिख रहे.
अच्छा, रिवर्स हो गया क्या कैमरा?
हाँ.
I don't know how to do it now.
कोई बात नहीं. फोन को
Okay.
घुमा, सवाल पूछते समय फोन को घुमा दीजिए अपनी तरफ. सवाल पूछ रहे हैं जब ना
हाँ,
फोन को घुमा
हाँ,
लीजिए.
हाँ.
रिवर्स द
Okay.
फोन.
Okay.
परफेक्ट.
हाँ, हाँ. Yes. Yes. Good evening, Guruji. आपका जो भी था, आपका session was really very informative. Just I want to ask about my daughter. She stays in Delhi. So we know ki what is the condition of Delhi, especially the NCR. And on the all about this, she has 3 pets, 2 cats and 1 dog, and they sleep on her bed and all. And maybe because of that, she continuously cough. Continuously means not continuously means she has since 6 months she has this coughing problem. She has done all the MRI. She is taking medicine, but that condition is not going. So it's maybe because of the pets or what, we don't know. So we are still worried because she has taken all kind of medicine because her father-in-law is a doctor. So they keep on giving the medicine, different medicine. She is taking heavy doses of medicine. This problem is existing since 6 months before this pollution started. Okay, so what she should do to curb this problem?
पेट्स को थोड़ा अलग करके 1 महीना ट्राई करें.
हाँ, क्या चीज अलग करें?
पेट्स.
पेट्स तो सर वो किसी के घर जा नहीं सकते अभी, वो पेट्स की जैसे जो हैबिट्स है, so they cannot survive without
She
her.
has to choose between disease and pets.
Acha, because of pets only she has coughing problem.
That's one of the problems.
Okay, okay.
And she should increase running.
Running. Okay. Acha.
And she should eat at least 1 meal of raw vegetable salad.
Okay, okay.
That's
Okay.
all.
Okay, thank you. Thank you so much. I will convey this to her. Namaste, sir.
थैंक यू. टाइम इज लेस, so fast Shiraz and Vandana. ये दो क्वेश्चन के बाद ये
गुड मॉर्निंग गुरुजी. वेरी शॉर्ट क्वेश्चन. एक्चुअली मुझे बहुत फनी लगता है आपको पूछने के लिए. सिंस 6 months है ना, आई जस्ट लॉस्ट माय एपेटाइट. मतलब मुझे भूख ही नहीं लग रही है. तो क्या क्या है? आई डोंट अंडरस्टैंड.
You can fast for a day and try.
हाँ, मैंने किया है. मतलब भूख तो नहीं लग रहा है, बट बॉडी वीक हो जाता है. मतलब मेरे हैंड्स ऐसे हिलने लगते हैं. आई फील द वीकनेस. So then
Hey,
I eat.
chew your food more than what you are doing already. Chew your food more. ज़्यादा
Yeah.
चबाइए.
अच्छा. Okay.
Better digestion.
ठीक है. Thank you.
Thank you.
Thank you.
Thank you, Shiraz. Thank you, sir. Vandana ji.
Ji, thank you, Abhinav ji, for scheduling this wonderful early morning meet with Dr. Arun Sharma ji. There was a question regarding asthma by R.K. Anand ji. So I wanted to just let him know that I have been suffering with the childhood asthma. Since childhood, I couldn't run even for a minute. And I was in Mumbai for during my childhood days, and I had to catch Mumbai local to go to college, office, everywhere. And when you catch a Mumbai local train, you have to run. Even for half a minute, I couldn't run. I had a small asthma inhaler in my bag all the time. But now, since last 4 years, I've been following a natural health science lifestyle, and I'm very proud to say that I have reversed my asthma. I can trek the mountains. I can run for a long duration. I followed all the instructions that Guruji has given us. And the way to go about it is by learning a healthy lifestyle, by following this knowledge of the ancient wisdom. So Guruji is the grandson of Acharya Lakshman Sharma, who was called as the father of nature cure in India. And his teachings are priceless. And when we follow this lifestyle and also pursue our passion, everything can be reversed. So, Guruji also runs a few courses and camps related to natural health science. If anyone is interested, can get in touch with me. Thank you.
Thank you.
Namaste. Namaste, everybody. Thank you for
Thank you
being with us.
Thank you, Dr. Arunji, for giving us this wonderful piece of your life in terms of your wisdom to all of us, with your answers, with your smile. Especially, I love that every question you receive with a smile, you answer with a smile. You just taught us by practice what you just told, because that is very important. When people can tell this, smile more, but they forget to smile while they teach to somebody else. But you are living example of everything you taught here. You took every question like a friend, like somebody who really cares, even though you don't know their history, but you really cared for their questions. You're truly a living inspiration, and we are all inspired to not just follow what you tell, but be like you. Be like Dr. Arun Sharma. Thank you so much.
Thank you.
Thank you, everybody. For more questions, use the group. We'll guide you there. So don't worry. We'll have WhatsApp group there. Thank you. Thank you, everybody. Have a great day. I'll send the task of the day in the group. Three takeaways for definitely, and something more which I'm going to share in the group. Just follow the group there.
Abha, you can share your question on the group. Maybe Vandana ji can convey to Dr.